Hi there. My name is Leila Hampson and I'm the pharmacy lead with the Centre for Sustainable Healthcare. I want to tell you about our project on medicines waste in care homes, which has been shortlisted to the final round of the Health Foundation Q Exchange programme. We need your vote to secure funding. In this project, we want to explore the factors which give rise to avoidable medicines waste in care homes and to explore the social and environmental impact of this medicines waste. At the Centre for Sustainable Healthcare, our mission is to inspire and empower people with the knowledge, skills and tools to play their part in the transformation to sustainable healthcare. This project very much aligns with our vision. Medicines waste is a huge problem within the NHS. In care homes, approximately £50 million worth of NHS supplied medicines are disposed of unused every year. This problem has been framed primarily in financial terms. We would like to explore the environmental and social impacts of this medicines waste and identify ways to reduce these impacts. The carbon footprint of medicines, inhalers and other devices contribute to a significant proportion of the overall NHS carbon footprint. Almost a quarter of the entire NHS carbon footprint is due to the use of medicines and inhalers. And it is not just the carbon footprint which we need to be concerned about. Clearly, wasted medicines are not a good use of resources. In addition, medicines, inhalers and devices tend to be made from or packaged within complex plastics which are not designed for reuse and are difficult to recycle. There is also the impact of pharmaceutical pollution of our waterways. It has been reported that 40% of the world's rivers may now contain harmful levels of pollution from pharmaceuticals. This has negative impacts on local ecosystems and biodiversity, and in the case of antibiotics, contributes to global antimicrobial resistance, which has been highlighted as a significant global public health issue. Medicines which are not used have the greatest overall negative impact, as they have not been taken, so have had no beneficial effects for patients. In addition to the extensive environmental impact of waste medicine, we would also like to explore the social impact of wasted medicines within the care home cycle. The monthly management of medicines within the care home setting is a logistically complex and time-consuming process, which is also high risk. Typically, care home residents are elderly, frail, and on multiple medicines. Any error in the medicines management process creates a risk of harm to the patient. The monthly cycle usually entails the care home staff ordering medicines for all of their patients, general practice staff, including prescribers and administrative staff, issuing prescriptions, and community pharmacy staff, including pharmacists and dispensers, dispensing the medicines and then delivering them to the care homes. This process can take up to 2 weeks and is repeated monthly. Any change to the medicines within that 2-week cycle can create logistical challenges, and a large proportion of staff's time, particularly in care homes, can be spent on the medicines management cycle. In addition, care homes, general practices and community pharmacies tend to be physically remote from one another in separate buildings and often several miles apart. This adds to the challenge of communication. In addition, at each of these 3 sites, workload is high and capacity is stretched. We would like to use our tried and tested sustainable quality improvement framework to study this current system across the 3 sites, to identify challenges which may be contributing to avoidable medicines waste, and to test out improvement ideas aimed at reducing the negative impacts of avoidable medicines waste. At CSH, we have many years' experience of using the SUSQI framework to optimize sustainable value within clinical pathways. We will use the sustainable value equation to study the system and measure environmental, social, and financial impacts of the current process and of potential improvements. We will use our experience and learning from the project to generate key recommendations and education resources for the efficient and sustainable management of medicines in care homes. And we will disseminate this learning to care home, general practice and community pharmacy teams and use our influence and networks to enact change at policy level. So please go to the Q Exchange website, read about our project, share any comments or ideas, and share our project with your colleagues. Please vote for our idea if you like our idea and think it should be funded going forward. Thank you.